This is Customer Service Training Module 2. This is a continuation of our Service Training module, and we're going to start talking about barriers. And that is the key word for this module, and it's removing barriers. So first, as an organization, we must remove any patient-perceived barriers and increase convenience for our patient. And the first thing we're going to talk about is insurance. We all know that we have to verify insurances before a patient comes in. But what if a patient comes in during the weekend and it's an emergency? We don't want to refuse service to our customers, so we have the insurance assignment waiver form, which they can sign so we can see them without being restricted by their insurance because we can't see them. So this will let them know that we are unable to verify their insurance. We do need to collect out of pocket, but at least the patient knows this and we can definitely see them for an eye exam. This can be used for holidays or weekends or whenever a patient comes in and their insurance cannot be verified. We do not want to inconvenience our patient because of a technicality. Second, the call center. We have instituted a 1-minute rule where all call center phone calls must be answered in less than a minute. Now, if there was an extended wait, then we have precautions that we can do or we can take, which is the billing department must help to reduce call wait times by helping the call center answer the phone calls. Now, if that doesn't work, we can request the staff from the Lake Mead office to come help at the back so we can reduce the wait, or if really as a last resort, calls can be transferred to the different locations or to their respective locations so we can help the call center. Third one is paperwork. We must relieve the patient of the burden of unnecessary paperwork. So if a patient is a previous patient, then we can make changes directly on their previous paperwork and just have the patient sign it. Now, if the patient is a new patient and they're unable to complete paperwork for any reason, like they can't read because they don't have their reading glasses, we'll be more than happy to help them. Fourth is walk-in appointments. When a patient walks in and wants to ask an appointment or if they can be seen right away, we must cheerfully accept that patient and be mindful of the patient wait times and the office flow. People can tell if you don't want them or not despite whatever you say. So if you tell them, sure, we can see you, and then you're hunched back and you have that look in your face like you really can't see them, you really are not doing them a favor. You should be able to say, definitely we can see you. The wait time is around 15 to 30 minutes. We do have 2 patients ahead of you, but I have paperwork for you to fill out and you can look at glasses while you're waiting. Then they can feel, okay, well, they're ready to take me in. They're going to work me in, and that's a positive feedback for the patient. Now, if we are able to provide clear and accurate wait times and stick to them, that's great. But if the wait time is becoming longer than we expected, for some reason there's something that happened, we should be honest and communicate with the waiting patient immediately and offer to reschedule or just let them know it's going to be longer than expected. Do not wait for the patient to approach you and become upset with you because we can't keep our promise on what time we're going to take them in. So the only thing we really ask you to do is to be honest with the patient, but also be professional. Don't let them know that there's a lot of stress. I mean, we understand that there's a lot of stress, but our point is we want to make the patients feel welcome and not unwelcome. Okay, the next part is removing staff barriers. So we're talking about barriers within the office that is out of our control sometimes, and we just we need to reduce that. But there are also barriers within ourselves as the staff members, and that's one of the things we need to tackle. We must always present the best option for our patients, and this includes all facets of our practice from technology to contact lenses. And what we're talking about is the Optimat, the Quantify, and contact lenses. We know that patients are here for an eye exam and we must treat them equally. So if we see a patient that may have, presented themselves as, I'm only wanting to to pay the minimum. I don't want to pay more than I should. Do not let that stop you from at least telling them about the OptiMap. We owe it to our patients to tell them about the latest technology and the healthiest option for them. It is their choice to make that option or to choose which option they want, but the point is we offered it to them. Our job is to properly educate the patient and every patient on optimizing their vision and maintaining a healthy eye, and everything we do should be in the best and primary interest of the patient. This is not forcing them to do the OptiMap, but at least we took that step to say, okay, this is what we have. We have the latest technology to improve your vision or to keep your eyes healthy, and this is what we offer you. That's all we need to do. We don't have to say, well, you have to do this to have healthy eyes. The point of the matter is we treat all our patients equally. Now, we were talking about technology. What we offer in our office is the latest technology, and we must provide the highest levels of technology and be proud to present every option that we have. The OptiMap, 6 years ago, we were the first office in Nevada to have the OptiMap. Now, 50% of all optometrists have the OptiMap or something equal to that. Now, for the Quantify, we are proudly the first medical practice that offers MPOD in Nevada. And for contact lenses, let them know that we have the latest technology like silicone hydrogel lenses like Biofinity and PureVision, and we also have in stock daily disposables, which are the latest in technology in terms of contact lenses to give them better vision and healthy eyes. Pretty much with the customer service, we want to let them know what we have and put our best foot forward, and that's really important. If you have any questions about customer service, let any of our managers know, and we'll be more than happy to help you explain so you can help our patients and give them better service.